very much. Well, welcome everybody. I'm John Duggan, and this is looking at ethics in the era of a pandemic. Um, kind of a, I hope it can be more of an engaging conversation. It's really a case study, and as I'll sometimes start sessions by saying, all stories are true. Some actually happen. And this is one that actually happened. And so I have permission from a friend who actually knew that I was doing a presentation for AADA and asked me to take his kind of lived experience, um, disguise it a bit. But said, absolutely, please share this. So to give us a little bit of framework for the lenses of human development that I'm going to suggest, ecological systems theory, okay? Bronfenbrenner's model, we have these different ripples. If you imagine we're dropping a pebble in and it's just going out, and we have these different spheres of relationship that we have, circles of influence in terms of our day-to-day life. We are all a part of a system, a global system that is in a pandemic. And I would say that there are multiple components to this because we're having flare-ups, right? We're having different variants that are also impacting our lived experiences, shared and also kind of regionally. So the ecological systems as a perspective I want to bring into our human development look at this case. Intersectionality, so understanding diverse social identities. I'll briefly share some of the identities of my friend, of this person who said, yes, let me be a case because I want counselors to know about these things so they could perhaps understand. And I think that we probably have an understanding of it, but yet need to put it into a flexible, a nimble, ethical framework. I come as a humanist, so I'm coming with that with multicultural, cross-cultural awareness, broaching experiences, um, a bit of existentialism. So for those that might go, oh, what are you doing to me? Think of the movie I Heart Huckabees from, it was 2004. And really what they were doing is kind of offering this perspective. It was Lily Tomlin and Dustin Hoffman. If you haven't seen it, I would say, take a look at it. It's kind of a fun movie, but I use it to teach some of the counseling theories on existentialism because there's this continuum between, let's say, like a nihilistic perspective of it means nothing, it's all absurdity, it being life. And then there is the other end of the spectrum, kind of coming from our friend Hegel, who gave us the dialectic. And that is the perspective of transcendence, that there is meaning making through our relationships. And, a little bit of a hint, I kind of lean on that side. My friend in this case study is actually on the other side and gave a really interesting compliment to me when we were on vacation a few weeks ago and said, you are perhaps one of the few people I know who strives to find a sense of hope and meaning in some circumstances that I typically just wouldn't go for. And he's like, I don't necessarily agree with you, but I find it delightful. And so that is how we're coming together, bringing these two kind of opposite ends of the spectrum together. Um, Emmanuel Levinas, a philosopher who, will just drop in for a second, he is looking at the relationship and the ethical relationship of how we create worlds of meaning. It could be through friendships, through our family. So if you're thinking the ecological model, we have diverse worlds of meaning that we engage in. Work, conference, colleagues, so all of these different relationships. And then there is this sense of epiphany, of amazing openness that happens because there is, from his model, an understanding of, from the postmodern perspective, of we have an ethical imperative to be connected to the other, to another person. And so it's that experience of being with someone else in that moment. All this stuff sounds like it's 50,000 feet in the sky, but think of what we do as counselors. We're there in the moment. And for some people, that may be the only time in a week or a month or what have you, where they're truly the center of our care, our concern, and they're being heard and listened to. For good measure, I'm going to say we need to kind of keep in our framework a legal ethical decision making model because we are working in healthcare. And so there are a variety of things that come in when we go through the process of kind of making ethical decisions in terms of practice. What is a better practice? And then that comes from Wheeler and Bertram. And then the last piece that I'm going to toss in there is the word crisis. In one translation of Greek, that means decision making. So it's about making choices and really living into our experiences. Sometimes we choose these experiences, and other times they're thrust upon us. Okay, so big heady framework, but I really want to open this up to a conversation. So here's this kind of a diverse social identities using intersectionality of my friend and his request of me to kind of share this for our conference discussion. Um, this individual is, let's say, mid-70s, has been a scientist, college professor, perhaps one of the most intelligent individuals I have ever known. Has fascination with science and preparing people for medical school and different medical arts, nursing school, and so on. Taught for some extra years beyond what would have been the retirement period, with hopes of actually being able to travel with his spouse, wife. So he is cisgender, identifies as male, um, and is in a heterosexual relationship, been married for years. And the challenges have been that along the way, so developmentally early on in life, there had been some critical incidents in mid-teenage years. And sadly, there were the deaths of his parents. And yet there had been a remarkable sense of engagement and having a wonderful relationship, mentoring students along the way. And this is also somebody who had a great command of, the science, classroom teaching, and so on. A lover of film, of arts and literature, and particularly uh, some some things that kind of leave me feeling a little kind of like, oh my gosh, I'm not quite into the horror movie type stuff, but absolutely loves kind of avant-garde film and things like that. Wife, his spouse, is a retired professor, nurse educator, um, and they had lived their experience with the intention, no children, but with the intention of upon retirement, they would be able to do a whole lot of traveling. And periodically we meet up with them. My husband and I meet up with them to spend some quality time together. Well, over the years, there have been major surgeries on his spine. And most recently, there were 2 knee replacements. Unfortunately, what has happened in the past couple of years is that there have been multiple unexpected medical issues. And so 3 years ago, we were walking around and enjoying a vacation together um, uh, in the hills of North Carolina. And this past summer, we were together, and he is now in a wheelchair. They needed to buy a new van, something that was completely unexpected. Um, he requires now a personal assistant to come at least during the weekdays, sometimes on the weekends. They've had to make adaptations to their house that they never had expected. Hobbies and things such as gardening, going out and bird watching, all of these things that, a biologist and somebody who is always been very active, all of a sudden, the ecological experience just started to really become smaller, not closed off, but smaller, and still finding ways to reach out and to have activities, but they require so much more time and patience for the individual that is going through this lived experience, as well as his spouse and other friends and family members. Now, the joyful piece of being with a counselor, I think, was that I was able to say during our vacation, you know what? We're so delighted to be together. Who cares if it takes us, 5 or 6 hours to get ready to go out? We're going to go out and have lunch, and then we're going to come back and we're going to have some wine and cheese, or maybe some beverages in the afternoon to cool off, some lemonade, and just relax and watch movies. And it really doesn't matter, because what is most important here is that we're together and we're sharing this time. And that did bring perhaps a sense of relief, because I think there was some angst about coming together. But the ethical questions that start to arise, think about the lived experience of this individual first. Having the sense of autonomy to make choices about life. Now, one diverse social identity I didn't share is he's atheistic. And so there is a component where, there's this piece of, well, when I'm ready to stop living, I'm ready to stop living. And so how do we honor that? How do we honor the fact that there has been an increased sense of pain and discomfort that is very, very subjective, and is really hard to report and express to somebody in a way that can be really comprehended. And if I'm looking at this through the lens of Emmanuel Levinas, it's like we have this ethical imperative to be present as a counselor to another and to hear their story as best as possible. My friend was talking about the struggle of increased anxiety and frustration, because a lot of things that had for years and until recently had been so easy to handle now are extremely arduous, frustrating, and sometimes confusing. And so there are medications that are being added for muscle spasms, for pain. There were none of the stuff that would have impacted cognition or an opioid or anything like that. Yet there are muscle relaxants. There are things that would handle neuropathic pain, both from the brain down. So you have something like, um, uh, uh, oh gosh, I'm even blanking on the terms, but who cares? It's medications from the brain down that are going to impact the sensation or the awareness of pain, but also from the nerves up to the brain, to kind of modulate that and reduce it as best as possible. And then you're adding in Wellbutrin as well as Buspar for the anxiety. Okay, so cognition, everything is staying in good shape, but the request was is to share and to really analyze this case study. What are the things that we can do as counselors to really acknowledge and ethically work with a client, a friend? In my instance, it's a friend, so I'm not going to work with him in that level or capacity. But as a practitioner, how is it that we're going to help the other? And what about the spouse? Now, there's one little catch that I want to put in. We're in a pandemic. So a lot of the stuff that we're doing is by Zoom. And we're even, kind of negotiating how to manage this. It became very, very difficult because, yes, he has been working with a counselor for a few years now as this has unfolded. One of his desires has been for the counselor to come to the house and enjoy, more from the perspective of a friendship, enjoy the interest in literature, but in particular the movies, because they have this amazing film collection, DVDs and such. And so one of the questions becomes, how do we handle that? And would, would where you're practicing, if we're using a legal ethical decision making model, would there be something from your state regulations that might influence your decision to do that? So I'm gonna kind of dial it back for a minute. I can keep talking forever, as some of you know. I can kind of move it along. But what are your thoughts about this case as I'm presenting it? And actually, I'm presenting it for both friends. Uh, it's predominantly uh, the husband, who was the professor of science, but also his spouse of 50 years or so, who is a retired professor of nursing and is seeing this from a different lens, and is meeting with the counselor periodically, um, but is also going through her own crisis or transformation or decision making process. What do y'all think? Dr. Rowland, I think you're
Yes, thank
muted.
you.
Welcome.
Well, thank you. Thank you. Um, I really like the case. I say that because it's so unusual. But, I think the developmental aspect of aging, I think now, I'm not sure I thought that 20 years ago, but I think now uh, begs us to answer a question for ourselves. Is it different when you are dealing with somebody of age? Let me say that. It, the closer you get to a higher number, I think there could be, I won't say wiggle room, because on the one hand, there is no wiggle room. On the other hand, we wiggle all the time.
Yeah.
So, we do. Uh, so I'm going to answer with a question to you. So one of the things that occurred to me a few minutes ago was, why does it have to be a relationship that has anything to do with counseling? Why can't that shift uh, because of the ages we're looking at? Um, and the scenario that would help them the most, I think, would be, and I'm not saying they need another friend, but because this person or you or the counselor is who that person is to them, I think maybe the value of shifting, verbally shifting, and saying, this is what we're doing now. So this is off limits. We'll get you somebody else if you need somebody. But now we're going to maybe wait, I don't know, a week, and then decide it's a shifted relationship, which I just made up in my head. And let's do what is most helpful to you. And if that is sharing a special film and then talking about life around that film, if that's sharing something else of life that wouldn't necessarily have been shared in a
Mhm.
previous relationship. But I think, John, honestly, only we as experienced people can make that decision. I mean, you have to be okay with it. I have to be okay with it. Is it something that I would contact my state board about? No, because I would not have, there's, I can take on people in any capacity I want to, depending upon what I do with that. Now, if you're going to charge for it, that, you may have to, but if you break that relationship and reform it and reframe it, then that's not in the picture.
Right.
But that's for me what I would do. It wouldn't be about money for
Right.
me.
Right. So what I'm to play with your question, and I'm so glad that you're engaging this way, because I think that it's important for us. So what we're really kind of doing is a mock consultation, if you will, and kind of processing it. And I would say, first off, with my lived experience, I, I'm comfortable disclosing that I had experienced, at a much earlier age, some issues related to ability status and disability and recovery with multiple back surgeries. And so there was this lived awareness of what it could be like. And, especially that last go around, it was like, whew, having to learn how to walk again. Um, and the struggle of, thinking back to the case, my friend, who was even, struggling with, incontinence and issues where it's just like, this is embarrassing. And we're kind of like, who gives a rat's tail? We're delighted to be here with you. But for the counselor, I'm with you, and I think that it is related to, there are some states that I know where it would not be possible in terms of their regulations. But I think in terms of informed consent and navigating the process ethically, um, yes, that focuses on A1A, which is the welfare and dignity of the person with whom we are invited to journey. And so then we have to kind of just be clear about what that looks like. Um, if I can, I'll share an experience. Once worked in a program here in Montgomery. I'm just outside of Montgomery County, Maryland, or in Montgomery County, Maryland, just outside of DC. And we used to have in-home visits, and this was kind of like the early days of telehealth, where we had usually it was a telephone call, but uh, working with seniors and persons with disabilities. And so it was working with somebody who might be my age, or it could be somebody who was 40, 50 years old, or I had someone who was 80 years old who was writing a book. Just fascinating opportunities. But there was one experience where the relationship had been appropriate and was regularly visiting the client at home, and the client was in bed, was not able to get out of bed because of renal issues and stuff. And so, it's like I would constantly just pull a chair into the bedroom, and we would sit and we would talk just like I would be if I were working in the hospital setting. Um, and I remember one time when there was a psychiatrist who was coming along with me, and it's not to, disenfranchise or speak unwell of another profession, but, the client said, would y'all like something to eat? And the psychiatrist said, absolutely, thank you, but absolutely not. I just had lunch a little bit ago. Now, I was not hungry. I was not interested in eating. But I said, well, of course, if you have something, but don't worry about making something. And the next thing I know, there was a turkey sandwich with, I'm a Miracle Whip guy. Um, it's kind of like made by my husband, who's a mayonnaise guy, and it had a little bit of mayonnaise on it. But you know what? I had it,
Yeah.
and my client couldn't eat. But she looked and she said, this is why John is like family.
Right.
And it left me kind of going, wow, this is the power of the relationship that we can have, but are we willing to try things and do things that are maybe not within our day-to-day practice, especially if you're trained in like a clinic, or it was the usual in an office setting. But can we be nimble enough and still have boundaries and clarify what the relationship looks like?
Yeah.
And those are challenging opportunities. Um,
Well, I mean, your examples are great. I think that we have to, or I have to, continue to learn that there are things that happen as we age that we didn't know we were going to need. And they're not always profound, they're not always debilitating, they're not always all those things, but they may be about reflection. Years ago, we used to do a lot of reminiscence therapy and uh, reliving, and I don't read a lot about that anymore. But I do think sometimes people just want to talk about what they've been through, and maybe it's repetitive. And if somebody said, well, is that really counseling? I'm going to say it again. When I'm counseling somebody, it's really up to them to decide what they want to say in their session. It's their session. Uh, you have to, now, if you're not very experienced, and everybody has to, I was not very experienced for years when I was a lot younger. So you have to just, stay the course and learn if you're willing and keep at it. I would have said something like, well, maybe I'm just wasting my time and they're wasting their money because we're not making any progress. But back then, if I had asked, somebody might have said to me, what progress are you looking for? I feel really good after this session. So what is the
It
progress
is
that we're
progress.
looking for? What does that mean? What objective number 2, objective number 3? I feel less anxious. I mean, if we had been able to explore, which of course now we are, outcomes, on whatever that means too, to somebody who's in that seat. But if I have 3 outcomes of one session where I do feel less anxious, I feel a little bit more energetic, and my heart is not pounding. Oh my God, you think I've done something with that person? They have done something for themselves. I happen to have facilitated it, maybe, because they have allowed me.
So you've hit an important point of what my friend was asking. He's like, please talk about this. It was a life of very scientific measure and outcomes, and really, controlled experiments, and what the insight is unfolding as we talked privately about it was, he was saying, I'm starting to really appreciate the work that you do, because it's not about the same thing that I might have thought and taught my students 3 years or 5 years ago, that there is this other piece. Now, still an atheist. I'm still, I still am who I am. It's kind of like the Popeye mantra, I am who I am. And yet I'm recognizing that there is something that is very important to me, to have this feedback, and to be present. And also, it's kind of like the ability to say, hey, so we're not going to leave the condo until 12:30 and go for a late afternoon lunch. 3 years ago we may have left at 7 or 8 o'clock in the morning and had breakfast and then did some touring. Times have changed. It's also a world of a pandemic, and we're also having to navigate our choices, being in this together, but also not want to getting too close to other people because
Yeah. So, John, I just want to stop a minute and AADA connection number 3. I don't know who you are. Can you say who you are? I actually think I know who you are, but
I'm sorry, can y'all hear me okay?
yeah.
Okay, so my name's Cassie. I'm a volunteer here trying to set everything up on Zoom, but I'm also a student currently. I just started my program, so I'm loving listening and getting all your feedback on this topic. So.
Oh, good. Thanks, Cassie. I was thinking we so seldom have room to do these dialogues on these forums. This might be I know it's being recorded. It might be a good one to listen to, just because of the back and forth with really 2 people. So that's kind of a gift. And I see Beth, and except I don't know who else is with Beth. Hi, Beth.
Hi, Catherine. This is Beth and my mom, Susan.
Oh, Susan, how lovely to see you. Very nice. Thank you for joining us. I mean, I'm sorry, it's not my presentations, it's Dr. Duncan's.
Well, you know how I roll. It's our presentation, and part of it was we're kind of looking at a case experience of a friend who said, "Please share my story to counselors." And the real quick thumbnail sketch is professor, science, spouse is a retired nursing professor. and has gone through over a 3-year period a really difficult life shift where he's now in a wheelchair and has much less autonomy, and so the ecological experience is shifting and sometimes shrinking, and so there's been an increase of anxiety, frustration, and wondering, like, one of the diverse social identities is atheist, and so the sense of, is this worth it? And part of the request is to share his experience, so that counselors at all stages of our professional lives can consider, what is it like to really be with a person as they're going through these experiences. And quite honestly, we kind of stepped into this, Catherine. It can happen at any age.
Oh, absolutely.
So that's the other piece that I think we need to keep in mind.
I think too, if I could, the way John first conceptualized the case was thankfully very broad and specific at the same time. So we had specific things to look at. But then, we got into, he asked for dialogue. So we got into dialogue around how is it different when you're dealing with somebody who is of age? I joined AADA 1 year after it started. So I've been a member a very long time and president twice of AADA. But I never would have imagined in my 30s that I would, not that I wouldn't be a member, but I never imagined that I would have so naturally reframed how it was to be 35 and how it is to be 74. And the things that I know about aging are just my own, but I'm well aware that there are people in the profession and in my life who are a good bit younger than I am, and I won't say act older, but it's hit them harder. It's hit them differently. And so that's what, as a full-time practitioner now, when I deal with people of age, and I don't deal with that many people of age, I mostly deal with young people. I'm not sure why that is, but it is what it is. It's always like, John was saying this, there's physical, there's things that happen that are debilitating to us, but then there are things just as we accept. Long ago, a friend of mine and I wrote an article, defeating the deficit model of aging, because it is a deficit model and it has been for years, because it's what you lose, but it really is what you have now, whatever age you are. If you're 30, if you're 20, if you're 70, if you're 90, that's what you have to, I think, really look at and cherish. I mean, if you're at a conference, that's part of being good. I'm sorry, John, go.
No, I was just going to say, and I want to invite, Beth and Mom to say some stuff, but it's like, that's why I brought in, and Catherine, you know me well enough, so it's just like, here he goes again with the existential thing, but it's like, that's why I brought in that piece of, for me, I come from the transcendent school where there is a sense of yearning, hope, meaning. It does not have to be a spirituality or a faith-based experience, but it could also be something of poetry, of finding meaning. And so for my friend who had asked me to share his personal experience, his lived experience as a case, for him it is movies and an absolute passion of that, and how it allows him to experience and then share and talk about things that are very meaning-filled for him. And that's been an increasing discovery. And of course, it's actually probably real delightful to spend time with me, because I'm like, I don't have a clue. I could have seen the movie 10 times. My husband's ready to bang his head against the wall, but it's like, I'm not sure if we've seen this movie. And then all of a sudden, when we get into it and I get the context, I'm like, oh yeah, oh, this one, yeah.
Yeah.
so how it unfolds. Beth, what do you have anything, any thoughts, or Casey? Do you have any-
You did.
No, you're good.
I'm glad I didn't know that.
We're not muted. We're not muted.
Oh, God. Okay. Oh, yeah, my brain was racing, especially about I think it's a delightful phrase, of age. Or is that what you said, Catherine? Uh, I'm 70, so I don't know what of age means yet. But I resonate with that, having to reframe where we are and decide how we're going to spend the fourth quarter.
Yeah.
In a positive way, as much I'm taking control of this part of my life when there's lots of it I can't control, like many of the declines that come our way without our asking for them. But so I really resonate with that, and I'm curious why we older people don't go to counseling and therapy. I do see people somewhat in spiritual direction, but in an informal way. They won't actually say they're coming for spiritual direction.
Yeah.
But I do see a lot of, and then you do too, you would probably see them too, a lot of people who are of age who are depressed at some level, but have a great denial about it. So I really don't have an answer so much as to say, I think you're onto something. And I think there might be a way to market. Market is a big word, an important part of any practice, to market what you do for the natural depression that comes with anything that's taken from us, whether it's a spouse or abilities. And maybe have more older people's images on your practice website. Now I've gone into meddling and because I know little enough about counseling to know that you can help people of age.
Well, and with your comments about, from the perspective of spiritual direction, it may not necessarily be what we would call a clinical depression.
Right.
However, it may be, if I may borrow the term from John Lacrosse, a dark night of the soul. A sense of ennui, a sense of a nadir, it's kind of like this desolation where there is this emptiness. But I always see this, and this is where I go back to the ethical imperative of how we reach out and are staying connected even through that. I reach out and see it through the concept of rites of passage and the liminal experience, where it's like, we're in a threshold and we're changing and everything is betwixt and between, up and down. We don't know what the hell is going on. There, I just said it, so I hope everybody's okay with it, but it's like we don't know. And that sometimes is so disorienting. And so the beauty of having whether it's a companion, a counselor, however that relationship needs to be, that can provide. It doesn't necessarily. I mean, there have been times in my life where it's like, oh, I wish this dark night would just kind of, move along faster. And please tell me at the very end, there's not going to be a light switch that says, please turn the lights off after you go out. I want to have a sense of, that, okay, so I still kind of was able to stick to that existential transcendent side of like, there is meaning in this, even when it really feels lonely.
Right.
And I think that there's a piece that can creep in when our ecological system, when our world maybe shrinks a bit. And I'm going to give virtual hugs to Catherine because, not too many years ago, I was not able to hop on a train and do a lot of things. And, 6-7 years ago, it was a matter of kind of a magical thing where it was like, okay, I can do this again. And I'm walking and I'm doing these things. And the world kind of opened up once again. So there's a sense of gratitude for maybe also say mentorship and friendship as we go through this.
I just have one little answer I want to say about seeing older adults. Many LPCs can't, see people on Medicare, can't, don't, all of the above, and we're working on it. I mean, my gosh, it's a long time, many years. Is it coming slowly? Maybe in some ways, but it's different and it's difficult.
I had not considered that piece.
Yeah. And we all, I think, do some pro bono stuff. On the other hand, if you don't charge, sometimes you can't do pro bono. It's just,
Yeah.
you're doing full time.
For years, I mean, it was $6.34 a session. That was the reimbursement, and it was with someone who was approaching 90, and so many different issues, but the desire was, I want to write a book. It's either I'm going to write this book or I'm going to give up on life. And I'm like, well, so how about we write this book? I've got a lot of skills, but coaching somebody to write a book is not one that I would think would be within my skill set as a professional counselor. And yet, guess what? This book got published.
Yeah.
For close to a 90-year-old. I mean, it was phenomenal, and it was so important.
Maybe that is the key. Whoever shows up, just honor who they are and what they're about.
Absolutely.
Right.
Absolutely.
I believe that's the ethical piece. And because I noticed that you were checking your watch. How are we doing on time?
Oh, I'm sorry. I just had a notification. You still got about 10 minutes.
Okay. I want to make sure that we're kind of holding good to the format and your needs as well. But I think that is critical. And the willingness to find ways to do it. It was very hard when I had worked for the program in the county, and the county officer said, well, I'm so glad you're opening up a private practice. I am going to have all kinds of referrals because nobody is taking folks over 65 that have Medicare. Would you please get on board? And I'm like, if only. I mean, this is a passion area for me. If only.
I'm a wanderer. I wonder what it might look like to have a model of group type sessions so that the money could come from a little bit from each one and might come closer to what an hour session would look like. Because the other thing I see with older adults is their isolation, unless they already have a well-established friend base. And it might be a way, a both and, to get paid and to provide them a support system.
Yeah, we've actually, so I'm a counselor here in Lafayette, and you want to tell them what you do?
I'm a retired pastor, still pastoring part-time. I'm a Tai Chi Easy practice leader and a trained spiritual director. So I just do pieces and parts.
So one of the things we talked about this fall is offering a group class, and that if the pandemic unfolds similarly to how it did last year, with any more shutdowns like we've seen, like we may experience, we've discussed the idea of having a group class, or a group, I should say, it'd be a therapeutic group and also a spiritual direction group where they could tell their own story. I think is that the title?
It's called Remembering Your Story, or God Moments. I have a lot of different sources.
But a way that they can remember their story, and for those who are able to either do scrapbooking or to bring their photos, and if it's in person, fantastic. But if it's not, then to see how we could do that online, to have that group cohesion and normalizing with each other's experiences, as well as honoring each other's story as they can write it down, as they can recall it, as they can take that time to remember the ups and downs and those moments with their spirituality and their where, like you said, John, wherever that is for them, whether it's in nature and movies, and how that helps them throughout their lifespan, right? So
Mhm.
we've been brainstorming, how can we do this so we can reach some different populations and it's not, and we do know technical difficulties could be an obstacle.
Though I will
That-
tell you, of age people are coming on because they're gonna find a way to Zoom with their loved ones. They're learning.
Mhm, mhm,
Mhm.
mhm.
Maybe
It's
not the
become a
over 90s.
necessity. It just really has.
Yeah.
Mhm.
Um, I love getting my oldest sister is about 74 and she just had a hip replacement and I love getting her finally got the upgraded iPhone and now I'm getting these really cool videos. And, she's actually giving me her own narrative of like, hi, my day, and we used to joke about it because I'm like, oh, honey, no. You do not want to, you live in New England, you do not want to go home and and do all of the things that need to be done to get into the house and take care of yourself after that first week. So we got her into one of the really great rehab places in town. And she was just, like sending me these videos, but I stopped just calling because she was having so much fun recording and sending. I mean, and then she was like, "Oh, I sent this to our cousin Marie, who's, she's 73, and she's doing all this stuff, but she wants to check in." And it's like, okay, cool, fine. Let's go with it. So I'm kind of saving them. We're growing up in a few weeks. I'm saving them, and I'm going to put them to a little bit of music and just kind of share them with her and say, okay, this
That's
is what
pretty
your
delightful.
life is like.
Yeah.
How you doing now?
Cool.
Yeah. I think you've got a really great idea. And it's an important one. And it's going to, and I'm not necessarily speaking for this session through the code of ethics, but I'm speaking about more of an ethical imperative of how it is that we make connection and really share our skill set. Because I think right now, our world has been in a place of uh, incredible need for the gifts that we have to offer.
Yep.
Our partnership that Beth and I are developing. I mean, I have this group of little old people that'll do just about anything I'm doing. But the piece that she brings is that therapeutic counseling piece that I don't do. So sometimes maybe partnering with somebody who just has a group that follows them for whatever reason,
Mhm.
and then that trusts you enough then to have a counselor be able to speak in their lives either as a group or separately. Um, sometimes you got to be a little conniving.
You gotta be creative.
Yeah. And Beth, I think the challenge for you could be the need as a licensed practitioner to go about really clarifying informed consent and the issues about we're in this and I am a mandated reporter. I cannot take that hat. That's something that doesn't go away.
Exactly.
These are the
Exactly.
things, these are the limits of the relationship and the confidentiality in times where I have to intervene if I'm really concerned for somebody.
And it's a both and, because I have to already tell them where I like. Spiritual direction does not mean counseling. It's not,
Mhm.
even though it has the word director, it's not
Mhm.
directive. So
Yeah, yeah.
so we both have that boundary that we
Yeah.
have to declare up front. So
Mhm.
Right.
Yeah.
Right. So I think we're about at the time. It's probably time
Yeah.
for another session. I just want to thank you all for your support and willingness and to allow me to kind of go from yes the big piece, but also to the very individualistic experience and how it is that as another mentor in my life said, we didn't give birth to ourselves. And so we're always already in relationship with one another. What does that look like? And so I hope that from an ethical perspective and looking at all of us, whatever of age we are, that that we still continue to find ways to make those connections and help people make meaning.
Hey, can I